Hey, Ali, so talk to us. What's one piece of advice you can give us this Monday morning?
All right, Michael, thanks for inviting me on here. I'll tell you, business owners, whenever you talk to these lenders, they always throw this statistic out at you. They say, less than 1% of all dental practices, fail. And they
Mhm.
always throw that out there because they're excited to want you to kind of be energetic and empowered to start your own practice or to buy a practice. But the reality is that it's really not 1% or less than 1%. There may be very few practices that don't do well, but a lot of people suffer, right? A lot of people suffer. The way to avoid suffering, the way to make the practice ownership kind of process exciting and fulfilling is to limit and minimize your exposure to risk, right? And so with that, if you're buying a practice, making sure you're doing all of your due diligence, right? Making sure you're looking at the patient, charts, looking at all the financials, looking at everything that you need to look at from a legal perspective to make sure that you're actually buying what you're buying. If you're doing a startup, making sure that you have a lawyer or someone looking at your leases and making sure that's done well. And then finally, I would say, making sure in either scenario that you have your HR house in order, that you are hiring your employees correctly, you're giving them lunches and breaks when you're supposed to, you're giving them overtime when you're supposed to, doing all those things that you're supposed to do, you're actually doing from a legal perspective. And I think if you do those things, your risks will be minimized and then you can not suffer. Right. And so, it's a little bit unpopular, but people are like, oh my gosh, less than 1% of dentists fail. So let's all go do it. And it's like, yeah, everybody should be a practice owner. Absolutely. But I want to prevent you from suffering. Right. And the
Mhm.
suffering is when, you don't do the right marketing, you don't have the legal components done well. And then over time you struggle and you grow not as fast as you should. You get sued, you get all those things happen. And that can really impact your happiness and your drive to continue growing the practice. And that's one of the things, Michael, that's been my mission throughout my career has been to help young doctors get empowered to become practice owners, but doing it in a way where their risks are minimized so that they don't have those exposures long term.
Gotcha. Okay, I like that. So one thing you mentioned is, which we appreciate that, right? The preventing the suffering, right? Because it is true. You can say you're not going to fail, but is it worth you know what I mean? All that, man, we've been suffering for like 20 years, 15, 10, 5, right? But you mentioned have your HR house in order. And I know something right now, and maybe you've been seeing this, Ollie, where it's like, it's hard to maintain or retain those great employees sometimes. And then sometimes it's even just hard to find
Yeah.
team members. So, what are your thoughts like on that when it comes to suffering in that sense?
Yeah. Oh my gosh. I'm so glad you asked about this because this is like one of those areas that we get so many questions about. Here's the thing. I'll tell you the number one recruiting tool, hands down, year over year over year, is not Indeed. It's not monster.com. It's
Mm.
not Craigslist. It's none of those things. The number one recruiting tool for finding really good employees is your current team. Because guess what? They're going around saying to people that because they have friends who are RDAs, DAs, hygienists, whatnot, and they're going to them and saying, you know what, I love where I work. My doctor does this and my doctor does that, and we have so much flexibility in this regard, or I get these benefits. And then their friends want to join the practice, right? So I always say it's really important from a recruitment perspective that you create an atmosphere that people want to come. And the best way for people to come is by the current team recruiting them in,
Mhm.
inviting their friends. And so I always say, talk to your team and say, hey, if you know anybody that's good, that's looking to change, please invite them in for an interview and whatnot. And you'll be surprised how many people do that if it's a good environment. If it's not a good environment, then they won't, right? They don't want to do that. They won't invite people to come in and interview and whatnot. So I would say from a recruitment perspective, I would focus on that. From a legal perspective, I think making sure you've got all the basic documents that you need when you're hiring everybody, making sure you have an employment manual and things of that nature. I think those basics that companies like HR for Health provide, I think are great. And if you do that, then that suffering goes down because the chance of a lawsuit also goes down dramatically.
Well, that's interesting. Where do people normally, in your experience, drop the ball when it comes to the basics?
I think they rely on companies that they shouldn't rely on for their
Mm.
HR. Like, for example, a lot of people will rely on their payroll company to provide them HR documents. Well, the payroll company is a payroll company. They're going to provide you the basic documents they need for running payroll. They're not an HR company, right? So I think that's the first. The second is not having an employment manual that's up to date. And I think, especially with all the rule changes since COVID, it's super important to have an updated employment manual. And then the third is what's called wage and hour. And wage and hour is something that's a problem nationwide because it's about paying people correctly for overtime, giving lunches at the right time of the day, giving breaks when you're supposed to, making sure the paychecks are correct, all the things around the financial side of payroll that people make mistakes on. So I think if you do those three things and you do them well, you're well on your way. HR for Health, from a HR perspective, will make sure you're hands down compliant from A to Z, 100%.
Okay, wow, that's amazing, man. I know you guys have a software too. Is that true?
So HR for Health is a SaaS-based software. So it's
Mm.
all online. The employees, clock in and clock out. They sign things electronically. So everything's very sort of streamlined.
Do you guys ever, if I needed like a person, you know what I mean? Like, hey, I need a consultant to talk about this type of like compliancy or something's happening, a unique situation, right? Do you guys have that too?
Yeah, absolutely. Yeah. We have an unlimited HR support actually, where they can be on the phone with one of our, HR experts at any time of the day, really all day long, and as many times as they need. If for some reason they can't answer it, then it goes one level higher to lawyers. And depending on where they are in the country, they'll either be talking to, our firm and someone like me, or a friendly firm that does a lot of HR. But either way, we take care of it.
Yeah, because I know that's super important, Ali. I feel like sometimes, maybe you might have seen this. We ask questions like on a forum, right? Like Dental Town or Facebook groups and things like that.
Yeah.
And people give their advice and opinions, but it's a different state, right?
Yeah.
Different rules, different things. And so, like maternity leave, right? Or when
Yeah.
it comes to, I don't know, like depending on should we pay them for lunch and learn, right? Kind of things like that. And so, do you see that a lot?
I do. Yeah. I like to think that people are good intention, Michael. And so when they go on these blogs and whatnot, whether it's Facebook groups or it's, like you said, like Dental Town or other things, that they contribute because they want to be helpful, right? And they're using their own base of knowledge. But you hit it on the head. I mean, I can't tell you how many times somebody has given advice to someone else without even knowing what state they're in. And if you don't know what state they're in, then how can you advise on any of these rules? But what people are doing is they're giving their own personal advice based on their experience, which may not be right. And what's scary is we see it sometimes where somebody takes that advice and does something with it, and then they get in trouble because it was the wrong advice. And this happened actually recently where, a young doctor coming out of school owned the practice for a few years and hadn't been paying their assistants minimum wage. They weren't paying them minimum wage in the state that they were in. Why? Because they had gone on one of these groups and asked the question, and the person replied with the minimum wage in their state, not in this person's state. And what's even worse, and you'll laugh at this, the payroll company that was running their payroll didn't even tell them. Right? Wouldn't you think, Michael, that if you're using a payroll service and you're paying someone below the state law in terms of minimum wage, they would tell you what that is? I mean, it's just like crazy. And they didn't. They didn't. And of course, the employees got upset. And when they found out, and it's funny because they went like almost a whole year, like 9 months without saying a word. And then that January, the law changed and the minimum wage increased. And then the employees saw it in the news and they were like, wait a second, like I'm being paid $14.25. It says minimum wage went up to $16 from 15, like something, like what the hell just happened,
Yeah.
And so like it was a disaster, but that's what I mean by, payroll companies are not HR companies. And there's so many ways of doing this wrong. And remember what we were talking about in the beginning about suffering? Like how bad does that doctor feel?
Yeah.
Right?
It's true,
It's not like I mean, you work with doctors all the time. They're not trying to steal from employees. They're not trying to not pay them the minimum of what but they just make mistakes. And like, it's just, that's the suffering that I want to avoid.
Yeah, that you want doctors to avoid. Awesome, Ali. I appreciate your time. If anyone has further questions or concerns, where can they find you?
You can just go to our website if you'd like. It's dmcounsel.com, COUNSEL, or you can call the office at 925-999-8200. And of course, if you just Google my name, I'm everywhere. And so you guys can find me there too. So.
Awesome. So that's going to be in the show notes below if you guys want to go in the show notes below and check out and ask and pick Ali's brain a little bit more, right? Let's go any questions or concerns about this. So awesome, Ali. Thank you so much for being with me on this Monday morning episode.
Thanks, Michael. I appreciate it.